relieving activities, and it's maybe a project that they can work on with that artist in residence that kind of brings up their mood a little bit and helps them get through their their procedures,
kind of fill in the gaps for you,
squeezing some model magic and having a little fun. And I'm seeing the person that is much more severe and is there for a long stay, usually needs to process some emotional trauma as well as some medical issues. So that's totally.
Would you say some
different.
of the patients you see maybe don't need as much art therapy, more maybe just creative process, just making art for fun? They maybe benefit just as much.
I never really know until I walk in the room.
Yeah, exactly.
I mean, I may have a whole description of what's going on, but I walk in the room and that's not what's going on. The person really does have a lot of social support, and the kid's doing really well, and they can make art on their own, and they're doing really great. And I do art with them anyway because there is no artist in medicine person.
So your role changes
My
a little
role
bit
changes
at that point.
a little bit at that point, but as an art therapist, we can do that. We're fortunate. I would say that the artists in medicine now, if they started doing some deep-seated trauma work, that would not be out of their scope.
Okay, I think that's really good. Good definitions there. I would say that I probably I didn't stay to the script at all that they gave us. Sorry, Heather. But
you can ask me some more questions off of there. Let's look at it.
Let's see. Okay. Why would a patient be referred to you as an art therapist or a creative art therapist instead of somebody who is an artist in residence?
Because of those reasons I described. Usually they have some specific behaviors that are so extreme. I even sometimes have to come in and do an art therapy assessment where I have to give them an assessment to find out, is it really medical or is it a mental health issue? Because the doctor doesn't know.
Okay. And that's is that who's giving you this kind of like, hey, go see?
Well, it's through the child life department, but they're talking to the doctor the social worker and the nurses.
And they're the middle people.
Yeah. Like, and then sometimes I talk to them too. Sometimes they'll come to me and say, hey, I need your help. Okay. This child is coming in saying they're having a headache, they're having all this stuff, and we've done all these tests and there's nothing there. The child's not sick. Sometimes we bring in a child and there's a Munchausen case.
Okay. So you don't know.
We don't know, but I can do an assessment, and then if the mom keeps coming in and saying that she wants the art supplies.
Well, it's not really how it works. Well, this works here.
And she's putting the words in the kid's mouth, and telling everything you want to hear, and the kid's not saying a word. Then we have that's an assessment. That's assessment tool in art therapy. So, but it has to do with a serious mental health diagnosis, which is becoming a big problem in our hospital. We've had 3 of them in the past 5 months.
Really?
Where there was a Munchausen case, yeah. That's a lot.
Now, is there a way to even prevent that? I mean, there's nothing you can do to even prevent that from happening.
No, we can't prevent it, but we can diagnose it.
Yeah, exactly.
And then we know that not everybody that walks in the room shouldn't be asked. The mom should be asked for so many different things that don't. And the child turns out that it's really not there for a serious medical issue.
Yeah, and then you're like, okay.
and there's like maybe 8 or 9 visits in the past year. And there's no medical diagnosis warranting
the red flag goes up.
Yeah.
Red flag goes up. And
yeah.
Have you ever collaborated with an artist in healthcare as part of your work as an art therapist?
Yeah, we have. I have on a tendency work with artists in healthcare. And actually, I do bring in artists in residence here. She works with the nursing program here.
Okay.
She's an RTC. I don't know if that's her. RCT or RTC, I always get that acronym mixed up. But she does present in my class, and she does some art, health, and wellness activities. And she works a little bit with hospice.
Okay, so that's more of her
and
population.
Comfort stuff she brings to the family.
Yeah.
And she talks a little bit about her
That's a lot
her
of
stuff.
arts. That's a lot about what arts and medicine is about.
Right.
It's just kind of humanizing the experience and making,
and she talks
people
about
feel
that to my class, and she is great.
And they probably can relate to it because they see how that they also have that feeling, that they're having that feeling with the patient or whoever they're working with. Right. When they're making the art with them, it's just a little bit more clinical in depth. There's a little bit of a separation.
Yeah.
Let's see, another question here that we kind of haven't asked yet. I asked you kind of what distinguishes between the two. What places do you think are the best setting for an art therapist?
For an art therapist?
Yeah.
Mental health counseling centers. In the case as I described my position at St. Joseph's, that is okay as an art therapist having that position. If that's and not a lot of hospitals have that. I'm very, very fortunate to have that kind of position in a hospital. Who determines the hospital? The hospital.
Okay, like the directors of the hospital or the board or something.
Exactly. St. Joseph's is pretty progressive. Compared to all the rest of the hospitals around here, they're very progressive. Because Tampa General doesn't.
Tampa General didn't have.
Yeah, they have a health and wellness person now, which is good. But they don't have an art therapist, which they probably should, because I've been working with them now, and Heather would attune to this as well, that they need one. And I keep saying you need an art therapist. It doesn't have to be me, but you need an art therapist. You need an art therapist.
Somebody make a call.
Exactly, because there's health and rehabilitation areas. There's some mental health issues there with some of the work that they're doing that's not being addressed. So I think that it could be.
Could be the best probably place if it was more permanent of a position.
I could see them in jobs like in art therapists in jobs like in prisons.
Okay. Yeah, actually, that would be really interesting.
With teenagers.
That would be really interesting to see some of the work that came out of that.
Yeah, Dave Gussick is really good with that. But yeah, like prison settings, like child. Family settings in homes where you're dealing with a lot of serious mental health issues with the family and trying to do. I'm pretty systems perspective because I also have a master's in art in marriage and family. So I do a lot of family systems work in the home. So I help the family, kind of reconnect and communicate and deal with all the. And you can use art as a tool to
kind of do that.
To do that, yeah.
Kind of similar to artists in residence, they kind of use art to kind of create that communication, kind of break that barrier down. Like, now we share something, we've made this together, and now we have something that we can talk about,
Exactly.
And it kind of helps break that barrier down. Like, okay, what am I going to say to this person? No, we just made this cool thing together, let's talk about it. And then now I thought about this other thing, and it kind of spins off of it from there. What are some positive things that came out of that collaboration that you had done in the past with artists in residence?
With the artists in residence here, it's been really helpful because it helps for me here, of course, in the education world, my students are tired of hearing me lecture about how wonderful it is. They bring somebody else in, and they're all like ears, right?
Yeah.
It's like, okay. It's helpful that way. But if I were just to set it aside and say in the community, it's really helpful because it helps balance it. If I'm working together with a family and I have a health and wellness person there, they can really help engage them in medical and health and wellness issues that I would have never thought of in the artwork.
Yeah.
I'm looking at different things. They're looking at like, okay, maybe there's an exercise thing, or maybe there's something that they want to do that's in their goal and their treatment plan that is not my forte, but it is theirs.
Yeah.
And they can make art around it. So
okay, that makes sense.
I have worked in that realm, and I think it's really helpful.
Yeah, having more people on the team, everyone kind of brings in their own skill set and their own.
And with family systems now, there's so many layers of problems. You can have a case manager, you can have an art therapist, have arts and medicine, you can have a social worker, you can have a psychiatrist, you can have, you know what I mean? Like, seriously.
To make a huge team that
exactly.
Everyone kind of collaborates together.
Not to overwhelm them, but also, too, there's some families that are so dysfunctional that they almost have to have that.
Yeah, that they benefit the most from it.
Yeah.
Or else.
Yeah.
That makes sense, really, honestly. Honestly. Well, I think for the most part that concludes our interview. I want to thank you for taking time out of your busy day to meet me in the lobby here of this new building that wasn't here when I was here.
Well, make sure you let Heather know that she missed out on what we seen with it when we walked in with the 3D printing Fab Lab now.
Yes, the Fab Lab, Heather. You got to check out the Fab Lab. It is insane. Well, thank you, Joseph, very much. I appreciate it.
All right. Thank you.